Inshallah, we are going to speak about the important policies and program infection control program related activities, implementation activities at the level of primary health center. Primary health centers are the main gate of entry to hospitals. The primary healthcare center building, it must be built as a healthcare center and should not be a regular accommodation building, so that it lacks all the required facilities and resources. So, any patient for the basic primary healthcare problems, when he approaches the medical health institution, he approaches the nearby facility to a nearest primary healthcare center, so that the building, the primary healthcare center should be well equipped, not only with the healthcare facilities, as well as with the location, the building, the infrastructure, so that it can accommodate all the guidelines which has been prescribed for its safety for the workers as well as for the patients and the surroundings. So related to the infection control measures, related to cleaning methods, disinfection, decontamination, all the and waste collection, storage, transport, disposal, all these infection control measures plays an important role for the application of the policies at the primary healthcare center. So the primary healthcare center, it should be located in an accessible location, easy to reach, provides car parking, and it should be well known by the neighboring community. And the presence of any active infection control program in at the primary healthcare center is a very crucial issue that helps to minimize the spread of infections from as well as to the surrounding community. Therefore, the infection control program, it should be based on the internationally known body with the well-known practices and the guidelines. So the standards which should be well framed by the internationally recognized uh, institution, so that the guidelines are standardized and the implication of the policies at the institution should be graded, so that the maximum infection control problems, so that it is protective to the employees and the patients who are visiting the center. But when we compare to the hospitals, the infection prevention control program, which we are applying according to the Sibahi guidelines and policies, it is not same as hospitals. It is different at the level of primary health center, because of its structure and capacity and the facilities which it is dealing with the patients. Hospitals, as you know, there we have long-term patients, immunocompromised, elderly, and there are special wards, ICU, OT, operation theater, pediatric units, ICU units, all this, compared to primary health center. And the prevalence of healthcare associated infections in the patients at the primary healthcare center in the kingdom is currently the statistics are not very clear. And because of this, the application of infection control measures becomes still more very important to avoid healthcare associated infections from the patients to healthcare workers and vice versa. Many infections in these patients is acquired in the hospitals, and these infections are primarily identified at the level of primary healthcare center after the early discharge. So the primary health center, it becomes very important nodal point for the early detection of all the types of healthcare associated infections. So the practice of infection control should be emphasized at the starting level, that is at the primary health center level. The risk of infection is also influenced by the various usage of medical devices, like whatever related equipments and materials and instruments are used for the patient care, like catheters, feeding tubes, like sharps, immunizations at the level of primary healthcare center, dental treatment, emergency services, the dressing room, okay, all these places where maximum use of infection control practices has to be applied, as well as at the laboratory. So emergency room, laboratory, and dental unit, as well as immunization and all the general clinic and whole center where there is production of infectious waste and practice of medical care is done there. Everywhere the infection control policy has to be implemented. To generalize and brief, what are the files which we need for the Sibahi accreditation of the primary healthcare center? I'll just go one by one listing. The infection control files for the application of policies, we have different files at the level of center. First, we have to make a manual of all the policies of Sibahi related for infection control, and the standards like IPC standard. We have different numbering and different topics are there. I will be discussing now, what are the headings under which we'll discuss the important issues. Like there are generally in between there are some missing, but there are at least 28 standards according to which the policies will be implemented at the center level. Then every department should have its annual plan. Similarly, the infection control will have the annual plan for the whole year. What are the activities, meetings, reports, stock, then the monitoring, monthly reports, annual reports, and healthcare workers training and reporting, all those things. So we will have a manual for the file first, where all the policies will be updated with the renewal dates, stamps, signatures of the authorized person. And next, the file will be there for the standards, as it was recommended by the Sibahi Accreditation Board. The standards will be arranged along with the whatever the next papers are needed for the related standards will be updated accordingly. Then the annual plan, as well as for the policy of hand hygiene, we will have a separate file of hand hygiene monthly and daily according to the WHO protocol. I had already discussed in the last workshop also about the hand hygiene file, and again we'll discuss it in detail separately, hand hygiene file. How to monitor the compliance of the hand hygiene, monthly recording of the statistics of the practice of healthcare workers of hand hygiene practice, all these things. So there should be a separate file for the hand hygiene. And the training file, the training activity of the infection control, what all activities will be done according to the year plan, the different topics, hand hygiene, personal protective equipment, then according to the blood spill management, what should be done, how to keep the environmental cleaning, then management of the sharp injury, then standard precautions or universal precautions. So different an exposure to the communicable disease, and also infectious disease nowadays as COVID-19 as a pandemic special concern. So all these different topics, the infection control practitioner will be the in charge, will be certified and trained for the implementation of the infection control policies and program at the level of PHC. The ICP practitioner will implement all these policies and do the training for the employees related to the concerned topics, and maintains the attendance and the PowerPoints and regular emphasized and enforcement of these training activities at the center. As well as the infection control practitioner will maintain the file related to cleaning schedule, wherever the cleaning schedules are there at the clinic level, at the clinics, general clinics, different types of clinics, at the dental clinic or dressing room or emergency room, and also immunization room, different clinics, as well as the waste room, then store room, as well as at the level of like washrooms, toilets. So everywhere the jadwal will be made, and it will be monitored according to the policy weekly, monthly and yearly. Then infection control measure checklist file, where we have a format of checklist where the infection control practitioner will do the rounds of all the primary health care center according to the policy recommended time, and monthly usually they will do all the rounds and look for the stock, and whether there is a good stock and implementation of hand hygiene or not, there is hand rub, hand soap, tissues are available or not, and whether the cleaning jadwal is going on, and waste collection properly it is going or not, so all these policies and lectures, these will be regularly monitored by the infection control practitioner, and it will be documented in the way of checklist in the separate file. Okay, then at the central level, the waste which is generated, infectious waste and general waste. The infectious waste, as you all know, it will be collected at a yellow bag, and it should be transferred with the yellow bin, and it has its own protocol and policy, waste collection policy, storage and transport and disposal. And for that we have a company here which is related with the waste collection and transport and disposable of the waste, hazardous waste especially. So that company is known as SEPCO, and the infection control practitioner will deal with the papers, forms of this SEPCO. Usually the company visits twice or thrice to the center for the collection, and it will give its documents for the collection of the waste, as well as the director of the PHC should get the contract with the company for SEPCO, so that it is dealing with the infectious waste with this company. So all the forms, weekly and monthly and yearly, all the forms should be updated in the form of a file. Next, MSDS, that is Material Safety Data Sheet file, in which there are certain hazardous substances, like every component of disinfectant or antiseptic or chemicals which are used for the cleaning, disinfection, decontamination, sterilization at the level of PHC has hazards. Okay, that is framed in the form of MSDS. Okay, so every component or the chemical will have its scoring according to MSDS. All the sheets of those chemicals of related hazardous substances recommended should be filed by the ICP, infection control practitioner, and updated, as well as she should know the information about its inflammability and toxicity and where it has to be used, and all those details has to be regularly updated. As well as nowadays, because of the pandemic issue, we have new guidelines, policies related to COVID-19, which has to be implemented at the central level, establishment of the visual triage, how it has to be conducted, what are the measures to be taken, the papers, the forms, the new renewed guidelines, and the pathway, how the patient should be traced from the visual triage to the reception to the emergency and the clinic. So all the details and the formats, another file will be maintained by the infection control practitioner, and also the information updated all should be updated by the ICP. And the laundry, as you know, I will discuss most points of the laundry. What are the linen used at the level of PHC and what has to be dealt with that. Next, the infection control practitioner, because she or he are dealing with the management of the infection control measures at the center. For that, they need chemicals, disinfectants, all the required materials, whatever the need is there, like hand hygiene gel, then the soap or the tissues or the disinfectants, whatever is needed, they will definitely indent for the stock for the from the director, so that the papers of indent also has to be maintained in a separate paper. Next, the statistics related to the employee health, like maybe whatever is the incidence of the needle prick injury at the level of center, that has to be maintained, monthly statistics, whether even if it is zero, the zero incidence needle prick injury report has to be maintained, and as well as the report of communicable disease CD file, any exposure to communicable disease like tuberculosis, mumps, measles, rubella, chickenpox among the employees. That main report also should be maintained for the implementation of the policy, which we will again discuss in few points. Another records which the ICP infection control practitioner has to maintain are sterilization records and employee health file records. These two sections will be dealt by Dr. Humaira later, inshallah. Then there are these rooms are recommended for the maintenance of infection control at the level of PHC, that is waste room, for storage and transport and all the collection of infectious waste. There should be a specific recommended according to the standards. The waste room has to be present, available. It's a very essential safety requirement of the Sibahi that every PHC should have a waste room. Then next is isolation room. Isolation room for the any case of suspected infectious disease or communicable disease, so that the other patients or the people who are at the center should not be exposed. So there should be availability of isolation room. Any suspected infectious case will be taken after the initial assessment, has to go to the isolation room, and there the management and diagnosis and referral will be conducted from the isolation room. And then for keeping the clean items or materials which are required for the application of the infection control at the level of PHC, there should be a clean room with the storage facility, so that we can keep all the clean materials which are not infected, and in a closed setting with the proper ventilation and cleanliness and statistics. The clean room has to be maintained, and the dirty room that will be there for the infectious waste or any used linen or any other material which is used for the disinfection at the PHC. So these two rooms also will be discussed later in detail by Dr. Humaira. The primary healthcare center, first it has to implement a coordinated program to reduce the healthcare associated infection. So first there should be a program. There should be one statement of authority, and they have to establish the authority who will be the personnel to engage or implement the policies, who will be the in charge, how the teamwork will go on, how the practices and guidelines will be applied at the center. So these all framework will be done in the infection prevention and control program. And the main person who is in charge for this process will be infection control program. Is in ICP, that is infection control practitioner, and this person has to undergo the certification and the proper training for the infection control program, so that it can be easily and in a well mannered and according to the recommended guidelines and standards, the policies can be implemented at the center. The approved guidelines, what we follow for the Sibahi here, is recent guidelines of 2018, third edition. The GCC Infection and Prevention Control Manual is there, and these guidelines are usually are taken as a reference for the application of the policies and standards at the primary health center. And the primary health center, first for the implementation of the program, will frame one committee, where that committee will be inclusive of different personnel, director and the medical director and the quality coordinator, as well as infection control practitioner. The team, the representatives from all the important concerned team people will be there, who will coordinate in the infection control program. And the committee should have terms of reference, minutes of meeting, the agenda, the annual infection control plan, what are the discussed reports are discussed. Usually every 2 months the committee will frame the updates, and they will keep on improving upon themselves, and any issues or any problems and what are the points which has to be implemented at the PHC level will be discussed in this technical committee. And every 2 months the report has to be generated, and it has to be documented and kept in the standards file. And the manual, which I was telling, which consists of the policies of all the infection control, including administrative and practice guidelines, like what are the scope of services, and organizational chart, like how the employees, different departments are there, what is infection control program, who will be the in charge, like how to communicate. All these details has to be there, and also vision and mission and values and the policies of all the related policies of PHC standards has to be documented in the standards file. The very important component of the infection control is PPE, personal protective equipment, which consists of gown, gloves, mask, and the protective eyewear, all these things. And the PPE kits will be available, and they have to be kept in all the places wherever there is a medical care given, and the exposure of healthcare worker as well as the patient, there are chances of infection. So everywhere PPE kit has to be used, and it should be well aware by the staff where it has been kept, and it has to be labeled that this is a cabinet for PPE. And in all the patient care areas, always keep updating. If it is used again, you have to refill the PPE cabinet with the kit. As well as the training always has to continue for the donning and the doffing, how to use, how to remove the PPE, and also to keep maintaining the stock of the PPE at the center. Okay. And as you know, it's very important nowadays because of the pandemic to keep these things very much updated in stock and quality, as well as the training for how to use the proper usage of PPE. Not only the proper usage, also the proper disposal of the PPE into the correct waste bin, and the methodology has to be maintained by the ICP. And the hand hygiene. All the center, wherever there are clinics and wherever there are patient care area, even in the patient sitting area, waiting area, in the corridors, and everywhere there should be hand hygiene gel, easy clean, in the very easily accessible by the patients as well as the healthcare worker. And also there should be a poster related to the hand rub or hand wash, and the 5 moments poster, and availability of the water, soap, tissues. So these wash basin centers, these things availability also has to be maintained by the ICP, and regularly updated and documented in the form of a hand hygiene monitoring file. Regular training will be conducted by the ICP for the implementation of 5 moments accurately and consistently, and also to monitor these 5 moments have been practiced or not at every clinic level. According to the sessions, the ICP will go and monitor and update in the file, and monitor the compliance. And if the compliance, and every 3 months to 6 months, the chart will be framed, a hand monitoring chart. And if the chart shows any dip in the practice of hand hygiene, again ICP has to reinforce the training activities, and motivate the healthcare workers to practice hand hygiene, so that the percentage of compliance, definitely it has to improve. Then the appropriate procedures have to be taken to prevent the healthcare associated infections at the primary healthcare center level. So with the practice of hand hygiene measures, by keeping environmental cleaning, regular cleaning methods, maintaining the jadwal, regular use of disinfectants, antiseptics, and maintaining the sterilization record, and sterilization of the dental or the emergency or any equipment which was used for the patient care, irrespective of the infectious status of the patient. The universal or standard precautions have to be followed, so that the safety culture behavior is developed among the healthcare worker to prevent the healthcare associated infections between the healthcare workers and the patients. And the ICP, the infection control practitioner, will also implement the policy which is recommended by the Sibahi for the cleaning, decontamination, and disinfection processes at the patient care area. So the approved list by the Ministry of Health for the usage of disinfectant and antiseptic, regular indenting, regular stock maintenance, regular disinfectants which has been approved, they have to be understood, and its nature of working, and what is the level of dilution, and all the details of these disinfectants and antiseptics which has been used for the purpose of environmental cleaning. Also the information has to be updated in the standards file. Then wherever there are patients and the patient care going on, definitely because of medical healthcare procedures, the infection generation is there. So what we are more worried about is the biohazard, that is infectious waste, which is color coded in the form of yellow. And the infectious waste, usually it will be collected in the trolley, which is yellow, for the transfer, which is specifically recommended. And a person who is dealing with the waste collection has to wear proper PPE, and the training has to be done to the housekeeping staff to regularly monitor and practice the infection control measures with appropriate usage of PPE. Then how to deal with the collection, how to transport without spillage, and how to keep it stored in this big yellow bin, which is kept at the waste room. The storage will be kept here, and finally the company SEPCO, it will come and regularly collect the infectious waste which is kept here. And regarding the sharps, and the sharps also, it has been maintained according to the policy. There should be the sharps always, whatever the sharps are there, it goes into this kind of puncture proof container, and once it is 3/4 fill, it has to be removed, and with the receipt of name of the clinic, with the person in charge and the date, and this without handling or any handling of inside this container where there are infectious and sharps inside. So these sharps also, they will be dealt later by the waste collection company. So the policy is there for the preventing of sharp injuries, which will be implemented by the IPC, where there is recommended standards and procedures for safe handling and disposal of sharps. There should be all the needles which are used and syringes which are disposable. Once the use is finished, there should be no recapping. Directly the syringe with the needle goes into the sharp container, and then no other mixing of other waste should not be done in the sharp container. And the sharp container should be well placed according to the recommendations at the place wherever the patient healthcare related sharp generation is there. And any accidental needle stick injury is there, that will be reported as incident report OVR, and injury report will be documented by the ICP. And finally, after the statistics of needle stick injuries among the employees at the PHC, the zero conversion rate will be calculated. That is, if there are any uh, infectious patients are there and accidental break, and there is any case of infection before the, if for example anybody became positive of hepatitis B, and then how many people among the needle stick injury after positive or negative became positive, or positive people became negative, all this conversion rate has to be maintained by the infection control practitioner. Okay, and these papers of reports of needle stick injury monthly, according to the standards of this sharp injury policy, the reports have to be updated and documented along with zero conversion rate. Then another thing about what can happen at the level of PHC or healthcare institution is any body fluid or blood, and any waste when if it is a spillage, how to manage blood spill or body fluid exposure management. Those things I have already dealt in the health education lecture, and again we'll deal it in detail. So the policy which is related with the blood spill or body fluid management has to be recorded at the with the standard file with the steps and the procedure, and with the OER form. And there is a policy for housekeeping which has specific recommendations and about the functions and the housekeeping policy, what are the approved list of disinfectants and the list of hazardous substances, as I have already discussed about MSDS, the materials safety data sheet for each hazardous substances which is used for the process of housekeeping for disinfection purpose, that has to be maintained in the file. And the cleaning schedule, the formats whatever is there has to be attached along with the policy, and the other file has to be maintained separately where the cleaning schedules are done for different clinics and toilets, waste room and store room and other patient care related rooms. The schedule will be maintained daily, weekly, monthly for these recommended patient care areas. Then there is a policy for sterilization, and this about there should be a sterilization room where all the equipments which are used for the patient care will be sterilized according to the specific and functional specification. There should be a room in the primary health care center, and this is one of the important policy essential safety requirement for the Sibahi for infection control program. So this will be clearly explained by Dr. Humaira, inshallah. As well as the healthcare workers, that is the employees health program, according to the employee health policy 2018, the implementation will be done same according to GCC guidelines. So any employee who is exposed and also protect the employee from the infectious diseases exposure and regular periodic examination of the employee to protect and prevent the healthcare workers and also to transmit to other patients, and their immunization records and management of their prick or any exposure and maintenance of individual employee health files and screening methods on serology and PPD records of the employees will be maintained, and it will be discussed later, inshallah. Also, the ICP team, this will monitor the exposure of the staff to the pathogens, any history of exposure of the employee to the TB or varicella, measles, mumps, rubella, and sharp injuries will be monitored and reported in monthly basis and documented in a file separately. And finally, once the Montu test or tuberculin test is done among all the employees and anybody who has been tested positive or negative, and at the end of the investigation, the calculation of conversion rate from negative to positive or positive to negative will be calculated and documented in the standard file that is called PPD conversion rate. Also, the Sibahi maintains a policy that is for standard precaution, which is very important to separate the patients from the communicable disease who are colonized or infected with the epidemiological important organisms. So to maintain cross-infection or transmission of communicable disease from the patient and staff, between the staff, patients and visitors, always standard precautions has to be followed and the policy has to be implemented, which is recommended by Sibahi, that is standard precaution policy, which is together it's a universal precaution of all the um, policy methodologies has to be implemented irrespective of the patient's infection state. So every employee has to practice hand hygiene and PPE and these standard precautions to prevent healthcare associated infections. Healthcare practitioner, that is infection control practitioner, also has to maintain the guidelines for prevention of infections among the patients, visitors and staff during the process of renovation. For example, if the PHC is getting renovated or any construction process is going on, any renovation process is going on, so during this also, according to Sibahi, there is one policy which will be implemented by the ICP, according to which we have some formats, and based on the level of construction and renovation, they will classify different classes. And why we are more worried is because After the renovation or during the process of construction, the healthcare workers as well as the patients, visitors, and staff, they are exposed for infection. So how to implement the policy to control environmental disinfection, so that to find out any fungal sporing is there or not, so that to overcome all these disinfection measures, policy has to be maintained in the standard file with the formats. Also, the policy is there related to infection control. Very important will be policy of reporting communicable disease. So, in the center, if there are any communicable disease, in the communicable disease, there are a list of communicable disease which has to be reported immediately within 24 hours, within a week, and also monthly statistics. So all these reporting methods and the formats has to be maintained in the file, and the list of all the communicable disease, as well as we have notification forms. Different notification forms are there for different types of communicable disease, for measles, rubella, chicken pox, and scabies and TB and others, and like suspected COVID or H1N1 influenza. All these different formats, as well as the policy which is meant by the Sibahi for communicable disease reporting, will be maintained in the standards file. Then, as such, in the PHC level compared to hospital, the generation of the linen or the used linen is less compared to the hospital. But usually, all the at the level of center, the disposables are used and recommended. And for the use of emergency, if there is any usage of bed sheets or curtains or blankets for the patient care, if it is needed, then it has to be used with the proper cleaning schedule and laundry forms, and regularly it has to be sent to the laundry monthly, recommended. But when it is soiled or when it is infected or used immediately after one patient to another patient, it should not be reused. The same linen, it has to be definitely changed between the patients and regularly laundered, and the form should be there for this cleaned linen, and they have to be well placed in a closed containers in a clean room, and the statistics have to be maintained and forms has to be maintained if these like materials linen, clean linen is been after laundry, and there should be proper documentation of these items. In the infection control program, the essential safety requirements of the waste room I'll be discussing. That is the waste room is very important essential requirement, because the primary healthcare center, I told you, it will generate the infectious waste because of healthcare activities, and these infectious waste is color coded with the yellow and with this biohazard symbol. And to safely collect, store, and transport the waste which is generated, infectious waste, there should be a properly designed according to the standards waste room should be available. For the ESR safety requirements are, the waste room should have a drain, so that the whenever there is any water collection and there is cleaning process happening in the waste room, the water is drained. And for the uh, worker who is associated with the waste collection, the wash basin with the proper hand hygiene procedure, hand rub, hand soap, and the posters, 5 movements, and the PPE kit, and the usage of PPE, and the regular stocking of PPE and hand hygiene materials. And at the door of bio waste room, there should be a biohazard label, and color coded with the yellow, so that everybody knows that this is a biohazard place, and no entry to the unauthorized persons, and the always it will be locked, so that any patients or visitors should not have any accessibility and vulnerability, to protect the any accidental exposure to the infectious waste. Always the door will be closed, and the keys will be kept with the concerned person. And the PPE, usually the waste collecting people who are dealing with the waste, and transporting and storing, they should use not the normal PPE, with the heavy duty gloves and the boots are recommended. And the stock should be there at the waste room, and the sharp containers should be in enough quantity, so that once they are full, three-fourth full, it will be disposed, and new sharp containers will be replaced at the patient care areas. And the trolleys should be properly designated. The one trolley should be for transport, for getting the infectious waste from the center, from the patient care area, and one trolley for the storage. So it should be clearly labeled, the trolley for the transfer and the trolley for the storage. And very good and proper steps and training methods has to be done by the infection control practitioner for the housekeeping staff to use PPE, how to report if there is any accidental prick to the sharps or infectious report, to maintain their immunization status, to proper disposal of the waste and the PPE, and how to collect, how to transport without spillage, with collect in the uh, spillage proof container, and regular stocking, and then maintaining the papers of the company of SEPCO. And the trolleys will be washed by the not by the housekeeping staff, the company SEPCO. They will come and they will clean the trolleys, and the papers will be documented. So these all awareness about the waste management, collection, transport, these details will be explained by the ICP to the housekeeping staff, because they should be very well trained, because they are exposed to infectious waste, and they should know how to report, and what is the procedure they have to follow to protect themselves. Then to also, the waste room should have good ventilation, so the waste is kept inside. There should be no development of any bad odors and infectious organisms, or any chances of exposure. So the ventilation should be properly maintained in the form of temperature chart, and the temperature thermometer should be maintained to record the device, to maintain the temperature levels. And then also the air conditioner should be functioning. Then ventilation infrastructure has to be maintained at the level of waste room for meeting the CSR requirements. Then, as I said, that the compliance and awareness of the transport without spillage, how to transport from the non-infectious to the infectious area. The housekeeping staff should know the pathway from how to collect in one way from all the clinics and the patient care areas, and get it back to the storage, to the waste room, without improper usage or spillage of waste. And as I said, the trolley will be washed, or whether it is not washed, all this documentation, and who will wash, who is the person who is concerned, and the papers and the company, all the details has to be recorded in the separate file of SEPCO with the contract of PHC with the company. Nowadays, as there are infectious cases, not only COVID-19, but any airborne or droplet infection or contact precautions, any mode of transmission of infectious disease can happen. So, according to that, in every primary health center, according to Sibahi also, and it should be nearer to the visual triage, near to the emergency room. As soon as any patient is suspected at the level of triage level, that this patient is suspected infectious case, then the patient will be transported from the triage to directly to the isolation room via a recommended pathway, and the pathway has to be marked on the floor, and the room should be labeled in this symbol, isolation room, and the room should be very well ventilated. Usually in the hospitals there will be HEPA filter, and for the respiratory infectious cases, according to the type of mode of infection, airborne or droplet or contact. But at the level of PHC, the room should be well ventilated with the exhaust fan, so that we can maintain the air should be not uh, it should not be accumulated in one place, so that there is more chances of infection. The ventilation should be so designed that all the air should be circulated outside, away from the um, room to the outside. And whatever the infectious waste is generated, there should be a bin, yellow bin, and general waste bin, and all the information related to hand hygiene, wash basin, and hand rub, hand wash, and tissues which are needed for the hand hygiene practice should be kept in the isolation room. And whatever furniture which is used in the isolation room should be of that material, like leather or rexine or any type of material which can be easily disinfected with the help of disinfectants. Any cloth material or linen or anything should be removed. And proper PPE should be used, as well, not only the healthcare worker, as well as the patient. When patient also goes to the isolation room or comes out of the room, should be using proper PPE, like surgical mask and proper methods of cough hygiene etiquette. All this information has to be given. And even at the outside of the isolation room, the yellow bin has to be kept, so that once the healthcare worker is after finishing the examination at the isolation room, after the patient is gone, when the healthcare worker comes out, they should keep one yellow bin, so that the patient after patient care, the healthcare worker removes the mask and puts it into the yellow bin outside. Inside they will not remove the mask. Outside they'll come and remove the mask. Inside they can remove other PPE. And also, once the isolation room is used by the one suspected infectious disease case, followed by that, the infection control practitioner should make sure that the isolation room has underwent proper disinfection and cleaning procedure. All the furnitures or the chairs or table or the couch where the patient was examined, that area has to be cleaned and disinfected. And again, the any usage of PP or any stock which has been used, it has to be refilled. And the ventilation chances, all these things have to be updated at the level of isolation room. Okay, so I would like to conclude. Thank you. These are the main policies which has to be implemented at the PHC center level. Very important concepts which I discussed, which are the must and essential for the implementation of infection control program at the level of PHC. That will be like housekeeping facilities, cleaning schedules, then maintenance of reports of sharp injury, then reporting of communicable diseases, hand hygiene policy, then what is the technical committee, what are the reports, documentation, then sterilization records, employee health records, and then infectious disease records, monitoring records. Um, checklist levels. So these are the very important issues, and every standard and policies again they will be discussed in detail. And this is the overall concise way of infection control program implementation at the level of center. Thank you for the participation.